Outbreaks of the deadly Ebola virus in 2 African countries have prompted the World Health Organization to declare a global health emergency. CBS's MTS Tayeb of our London bureau reports on the efforts to contain it. MTS.
Jarika, good evening. There's a major push to contain this fast-moving and deadly outbreak of the Ebola virus. The Democratic Republic of Congo's government has said it's activated a public health emergency operations center, strengthened epidemiological and laboratory surveillance, and ordered the rapid deployment of response teams in an attempt to contain the outbreak. This remote corner of eastern Congo is on edge. In a nearby gold mining area, Ebola is spreading fast and people are dying. John Kasembo is a motorcycle taxi driver. We are very afraid, he says. Since the beginning of May, many people have died, and it keeps happening. We're so scared. Kasembo is right to be afraid. Spread through direct contact with bodily fluids and through broken skin, Ebola causes severe bleeding and organ failure. There is no proven cure for the virus, and according to the World Health Organization, the average fatality rate is around 50%. CBS News medical correspondent Dr. Celine Gounder says containing the virus won't be easy.
It's already a big outbreak at the point that we're hearing about it. There have already been a number of deaths, and this is a strain of Ebola for which we have no treatment, no vaccines.
This is the Democratic Republic of Congo's 17th outbreak of the deadly viral disease, which was first discovered in 1976 in what is now the DRC and is thought to have spread from bats. It's also unfolding against the backdrop of a deepening security crisis in the region, where clashes between rival militia groups have killed dozens of civilians in recent weeks. And tonight, global health experts are warning the Trump administration's dismantling of USAID and withdrawal from the WHO may have a serious impact on the global effort to contain the virus, Jarika, an Ebola outbreak which has already claimed dozens of lives.
MTS Tayeb, thank you.
This morning, the CDC confirming an American doctor doing missionary work in Central Africa has tested positive for Ebola and was evacuated with his family and another U.S. doctor for medical care and supervision in Germany.
The person developed symptoms over the weekend and tested positive late Sunday.
International Christian Missions Organization Surge saying Dr. Peter Stafford and his wife, Dr. Rebecca Stafford, were treating patients in the Democratic Republic of Congo when they were exposed to the virus. The third missionary doctor also came in contact with an infected patient, but officials say so far only Dr. Peter Stafford is showing symptoms. It comes as the World Health Organization declares the Ebola outbreak a public health emergency of international significance. The rare variant of the virus is suspected to have killed at least 131 people so far, and doctors are monitoring more than 513 suspected cases in Congo. A few others also reported in neighboring Uganda. Dr. Craig Spencer survived the virus during a 2014 Ebola outbreak.
My biggest concern about this outbreak is that we learned way too much, way too quickly for this to be anything but really bad.
Dr. Spencer telling ABC News he's thinking of Dr. Stafford and his family.
I unfortunately know exactly what it feels like to be in that situation, to be incredibly fearful, to have a disease that maybe you've seen the impact of and know that there's not a treatment for. I'm thinking of him and his family.
And Michael, as for that 30-day travel ban, it only affects non-U.S. citizens who have traveled to parts of Central Africa in the last 3 weeks where this outbreak has been declared.
I'm going to be honest. The second I heard the World Health Organization declared the Ebola outbreak in Africa a global health emergency, I knew things wasn't going to end well. Mind you, this Ebola strain has no approved vaccine. And the thing about Ebola people never forget is how terrifying the symptoms are. You got fevers, vomiting, weakness, bleeding, and that leads to organ failure. This outbreak is taking place in the Democratic Republic of Congo and has already spread to Uganda. Health organizations are saying that this strain is dangerous. This strain of Ebola is rarer and less understood than the strains most people hear about. And again, officials are openly saying that there's no currently approved vaccine specifically for this version. Mind you, there are over 90 deaths so far. And on top of those deaths, there are over 300 cases. They're saying that this outbreak isn't pandemic level, but they're declaring it a global health emergency. So what does that mean? That means that's one step away from being a pandemic. This ain't one of those you catch a cold and you'll be all right type things. This Ebola strain has a 50% mortality rate. And they're also saying that this strain can be spread through bodily fluid. And again, they have no treatment, no cure, no vaccine for this Ebola strain. You have online doctors saying that this thing can get way worse than what it is. You have to understand where this can go if this doesn't get contained. Pay attention.
Well, breaking fuck the news, and good morning. The World Health Organization has declared the latest Ebola outbreak in the DRC and neighboring Uganda a public health emergency and international concern after the virus killed nearly 90 people. A couple days ago, I said it only killed 63. In a matter of 2 to 3 days, it has killed 30 more people. The outbreak, originating in the eastern DRC Ituri province, involves a rare, I cannot say the name, strain of Ebola. The variant has no approved vaccine or treatment. You just have to suffer and die. The health authorities said the outbreak poses a high regional risk because infections have already been detected in Uganda. Cases linked to the outbreak have reached the Congo's capital, and it's also spreading to other places, and they are currently monitoring the situation. The WHO, the World Health Organization, however, stopped short of declaring a pandemic, saying it did not meet the necessary criteria yet. The United Nations agency advised countries against closing its borders and restricting trade. The outbreak was first reported in the Ituri province in northeastern DRC on Friday near the borders of Uganda and South Sudan, according to the Africa Centers for Disease Control and Prevention. As of Saturday, the center has reported 88 deaths and 336 suspected cases. The cases are spreading quickly and fast. And since there is no treatment, these people just have to suffer, like I just said. I'll keep you guys updated with more.
There's a new Ebola outbreak in Central Africa, mainly in the Democratic Republic of Congo, but there's now one case reported in Uganda. There are close to 250 cases and 65 deaths from this outbreak. Ebola virus can be deadly, but it is difficult to transmit because you need to have direct contact with bodily fluids from someone who is actively having symptoms, but it can make people very sick. There are health authorities working very diligently to try to contain this outbreak, and the CDC is lending support. Public health experts have warned, though, that with the dismantling of USAID, the ability for global health responses is limited due to this important organization to be able to help to respond to outbreaks like this. Countries have much more experience with handling Ebola outbreaks since there have been several over the last 12 years. And so there's really no reason to panic at this time, as Ebola virus is nothing like COVID-19, but we do need to be aware of these global health outbreaks, as this can affect us in the future, especially when we have public health institutions that are not operating fully. And that's typically when we pay attention more, when we have things missing or when things aren't going wrong. When public health is doing well, you typically don't hear about it.
Hello, you guys. Well. After 2 weeks of worrying about the hantavirus, now we're worrying about another virus from the past. Okay. I don't know how many pandemic viruses, diseases I have done on this channel, but it's just a lot. And now they're saying that Ebola is coming back and more vicious than the previous in 2013. Now, from what I can remember about the Ebola virus, right, I, I just heard people got it. I haven't seen the people around me with it. And then all of a sudden it went away. And then it came back because somebody had sex and caught the Ebola virus. And now they were saying, like, oh, you can get it through sex. And then it went away. So that's my memory of it. And now they're saying that this Ebola strain, has no treatment whatsoever. So, everybody, let's just forget about the hantavirus. It's gone. Now we're on to the new virus that can become epidemic, supposedly. So if you want to see the timeline about how this started, you can go onto the WHO website, the World Health Organization website. I just got a key few dates here. So basically, on May 5th, 2026, the World Health Organization received the news about an illness with a high mortality rate. On May 13th, 2026, the outbreak was confirmed to be Bondubo virus disease. On May 15th, 2026, was declared, I think it was like a ministry or something of health, declared the 17th Ebola disease outbreak in the Dominican Republic of Congo. But on April 24th, 2026, the first known suspect was a healthcare worker and had onset symptoms and died at a medical center. So, the Ebola virus is contacted, you can contract Ebola virus through direct exposure of bodily fluids. I guess that's saliva, semen, blood, mucus, you name it, from an infected person or animal. Ebola becomes contagious in the late stages, and Ebola remains contagious up to 3 days after a person dies. The symptoms of Ebola is fever, weakness, muscle pain, headache, sore throat, vomiting, diarrhea, and bleeding. You can get these symptoms from 8 to 10 days, but it takes 21 days to develop all these symptoms at once. As of May 2026, this month, health authorities recorded hundreds of deaths and hundreds of cases in the Dominican Republic of Congo. The WHO declared this a public health emergency international concern on Sunday. This strain, so that was the 18th. Ebola is called Bundibugyo, Bundibugyo strain. There is no treatment for this at all. For there has been 131 fatalities and 500 more cases. Symptoms, I already told you guys. The exposure Ebola death rate, the mortality death rate is 50%, so you can survive it. But in some cases, it's 90%. So very high mortality rate. Each article that I read, it says mortality rates keep going up and the cases keep going up. So I got 500. The next article that I read said it was like 531 suspected cases. They do not want this to spread to the United States, so they're keeping a handle on this. So if you have been to the Congo or Uganda, you cannot come into the United States whatsoever. But hell, what do I know? I'm just a talking head.
The World Health Organization has declared the breakout of Ebola in the DRC and Uganda as a world health emergency, y'all. Baby, and this Ebola strand has no goddamn cure at the moment. There is no vaccine. Now, after the WHO organization discussed everything with every state and every party, they're determining the Ebola disease caused by the B virus. I cannot pronounce that, don't ask me. In the DRC and Uganda is a public health emergency of international concern, but it's not at the criteria of pandemic. It sounds like a precursor to a pandemic though. 80 people have lost their lives already. 246 suspected cases. And you know who specializes in Ebola breakouts? The United States. But we're not even a part of the WHO organization anymore. And Wigzara's cut off the USAID that goes to Africa in those countries just in case of outbreaks to help and assist and control the outbreak. Now, I don't want to think about the worst, but let's just say we have an American over there right now and they travel back home with that shit. And we're not even a part of WHO. Where are we going to get the help? RFK Jr.? Now, I don't know why TikTok doesn't want this information to come out, but the last video I reported about when it came to the Ebola outbreak in DRC and Uganda got hit with a violation. No specific violation. I fought it and they gave it back to me. And then an hour later, they took it back. So I'm disputing it in a ticket. But here's an update. 6 Americans have been exposed to the Ebola virus in Congo. Yes, 6 Americans. And this is according to Reuters, Yahoo, CBS News, BBC, and the New York Post. Now, according to multiple news stations, 3 of the Americans faced high-risk contact or exposure, and 1 was symptomatic. It wasn't immediately clear whether the Americans are still in Congo or not. I want to remind y'all that 80 people have lost their lives in Uganda and the Congo over this Ebola breakout. Now there's more than 300 suspected cases. Now the CDC says at this time, the risk in American public remains low. And the health agency has issued a travel advisory for Americans traveling in Congo and Uganda. Practice enhanced precaution and avoid people who have symptoms. How the fuck are you supposed to know? At this point, keep y'all asses where y'all at. Now here are some of the symptoms. Fever, muscle pain, rash, headache, vomiting, severe weakness, abdominal pain, nosebleeds, vomiting. That could be the flu. That could be a stomach virus. That could be multiple things. But I don't want nobody to panic. So an American medical missionary has been diagnosed with the Ebola virus. Dr. Peter Stafford. And he was in the DRC. Remember I told y'all this morning that there were 7 Americans that had high contact risk of the Ebola virus. Well, they're all going to Germany. Yes, they're not coming here. They're going to Germany. According to CBS, they're going to Germany for specialized care and monitoring following the deadly outbreak declared a global health emergency. Now, the Ebola virus has claimed 100 people now. It went from 80 people this morning to 100 people now. There are hundreds of suspected cases. Now, the CDC has noted that while the outbreak in Central Africa is escalating, the risk of general public in the United States still remains low, as long as they keep their ass out of the United States. And according to CNBC, Wigzara's is worried about the Ebola outbreak after he found out that one of us has been tested positive for it. Now, I want y'all to keep in mind that the United States is not a part of the WHO organization. Okay, so if something happens over here, I don't know who coming for us. On top of that, Wigzara's is the one that cut off the study of Ebola viruses. Okay, he cut that shit off. But I don't want nobody to panic. Now, I don't want nobody to panic, but this Ebola virus is spreading fast. Last night, I reported it claimed 100 people. Now it's over 130 people. According to the New York Times, there are over 500 cases now. I guess Wigzara's was really fucking scared because the United States has now restricted entry from people who have been in African countries. So if you over there and you trying to get back, my bad. For once, they did something right. Now, the director of the World Health Organization said this: "I'm deeply concerned about the scale and the speed of this epidemic." Now, the type of Ebola virus that is responsible for the latest outbreak, known as the Bundi Bujoy, is very rare. And once again, this form of virus has no treatment or vaccine right now, making it harder to contain. Now, people are trying to bring Obama into this. I know, crazy, right? There was an Ebola breakout in 2013 when Obama was in office in West Africa. Now, according to the National Archives, there were over 28,000 cases and over 11,000 deaths. 11 cases came from Americans that were helping in West Africa. What did Obama do? In September 2014, Obama ordered 3,000 military service members to Liberia to build treatment facilities and to assist in any way possible, and also requested billions of dollars in emergency appropriations from the Congress to help fight this virus. I can guarantee you Wigzara's ain't gonna do shit but close the goddamn borders. All we can do is sit and wait, but I don't want nobody to panic.
The Ebola outbreak in the Democratic Republic of the Congo and Uganda is a global health emergency, according to a new declaration from the World Health Organization. Here's what we know. The WHO says at least 300 suspected Ebola cases and more than 80 suspected Ebola deaths have been reported in Congo. 2 confirmed cases have also been reported in Uganda, but those patients had reportedly recently traveled from Congo. The cases are centered largely in Ituri, a province in the northeast part of Congo, already dealing with an ongoing humanitarian crisis and extreme violence from militia groups. Now, this outbreak is caused by the Bundibugyo virus, a rare variant of Ebola that does not have an approved vaccine. That, combined with the rapid rise in cases, prompted the WHO to declare the situation a public health emergency of international concern. That's not as high an alert as a global pandemic emergency declaration like COVID-19, but it is meant to prompt a coordinated public health response. Ebola is spread through direct contact with bodily fluids from an infected person. Its symptoms like unexplained bleeding, nausea, diarrhea, and vomiting develop rapidly, and the disease is often deadly. The Centers for Disease Control and Prevention said it is coordinating the withdrawal of a small number of Americans affected by the outbreak. At least one American missionary has tested positive for Ebola so far. The CDC is also enhancing health screenings for travelers from Uganda, the DRC, and South Sudan. Those who have visited the countries in the last 21 days and do not hold U.S. passports could face entry restrictions. This Ebola outbreak comes after the Trump administration eliminated USAID and slashed funding to the CDC, cuts that could diminish how well the U.S. can respond to an outbreak.
Support journalism you trust. Support PBS News. Donate now, or even better, start a monthly contribution today.